Hello, everyone. Welcome to our webinar on the impact of COVID-19 on the food sector. First of all, we'd like to thank you all for joining us today. My name is Elvan Yalçın. I'm the Marketing Manager EMEA for the Food Division at NSF International, and I'll be doing a quick introduction and then leave the floor to our experts. Today, we'll try to touch upon the challenges and pain points that we have emerged as a result of COVID-19 on the various parts of the food supply chain. And we have several experts from NSF International to cover different areas that are impacted. Our presentation will take around 35 minutes, and we'll be covering the novel coronavirus and its impact in Europe, retail sector challenges and future scenarios, food manufacturing challenges and possible solutions, diversification of food offer and the booming takeaway business, and finally, learnings from China's coronavirus recovery. And after that, we'll have a Q&A session to answer all your questions. You are muted, all muted, but please feel free to type in your questions during the presentation in the chat box, and we'll answer them at the end of the session. Our presenters are Dr. Meike Morre, who is the head of Microbiology department in our lab in Germany, Dr. YuLong Shan, who is the managing director of our China office, Craig Adams, client director of retail services in the UK, Jackie Healing, consulting and technical services director in the UK, and Benoit Blangy, who's the associate director of technical services in the Benelux region. NSF International is an independent, not-for-profit organization dedicated to providing services to improve public health and safety. NSF's food group tests, audits, certifies products and systems for the food sector to minimize the adverse health effects and protect the environment. And independent from certification, we offer consulting and training services to food-related sectors. Our food services serve the agriculture, retail, food manufacturing, hospitality and leisure, catering and food service, institutional, food equipment, and non-food compound sectors. Now, Dr. Meike Morre will start with our presentation on the virus and its effect on our continent. The floor is yours, Meike. Thanks.
Thank you. Thank you, Elvan, for the nice introduction. I'm Meike Morre, head of the Department of Microbiology here at NSF in Germany, and I'm going to give you a short introduction on the new coronavirus. So the family of coronaviruses have been first described in the 1930s. The first human version of this virus was described in 1965. It's an enveloped virus, which will become important later on as I'm speaking a bit more about it. And in humans, it's usually responsible for a variety of very mild upper respiratory tract infections. So about 15% of the common colds are caused by coronaviruses. There are many more strains and reservoirs, mainly animal reservoirs, mainly mammals. Researchers are most focusing on at the moment is the bat reservoir, so the horseshoe bats of Southeast Asia, as those coronaviruses have been shown to be able to switch hosts, so cause a zoonotic disease in humans, such as the severe acute respiratory syndrome, so SARS in 2002, and the Middle Eastern Respiratory Syndrome, the MERS epidemic in 2008. So, of course, now we have a new or a novel coronavirus here, which has been called SARS coronavirus 2 to reflect the close similarities to the SARS epidemic. And of course, you all know we have a worldwide pandemic of this virus as of now. It's highly infectious even before patients show any symptoms, and it's of course causing the coronavirus disease 2019, the so-called COVID-19, which can be asymptomatic but also cause severe respiratory distress and is currently threatening to overwhelm several healthcare systems. So as I mentioned before, it's an enveloped virus, so it can be inactivated quite easily because it has a fatty outer layer, the envelope, which is inactivated by soaps, ethanol, or also laundry detergents or temperatures over 60 degrees. The good thing is there's currently no transmission via food known if proper food hygiene is observed. So washing hands, washing your equipment, using the proper protection equipment, cooking and cleaning food properly. The World Health Organization has issued some guidelines regarding workplace behavior guidelines that should be observed, as the main transmission pathway seems to be droplets and direct contact to infected persons or contaminated surfaces. The most important one is, of course, the hand washing and the regular cleaning or disinfection where needed of surfaces. With soap or ethanol, for example, the physical distancing we're all experiencing as of now, of course, limiting the number of direct contact persons and ventilating rooms where this is possible. And of course, the most important one, to stay at home and self-quarantine if anyone is exhibiting symptoms. I'd like to conclude this short introduction with a short timeline of events as they have unfolded in Germany. As you all know, the main focus at the moment is to flatten the curve, as it says, to stop the exponential spreading of infections and accordingly the deaths. Starting in early March, the first thing the German government did was banning events and gatherings of more than 1,000 participants, which alone would not have been enough to stop this exponential spread of the virus, as you can see in the simulation that was done by a university in the red curve on the upper right. Followed by school closings and closing of non-essential shops, playgrounds, and tourism in the middle of March, which would have flattened the curve a little, as you can see in the with the orange line. But then, of course, the public lockdown at the end of March with a ban on gatherings of more than 2 people, the closing of restaurants and non-essential services. Seems to be working, as we have some data now in the green curve. The infection rates really seem to drop. But of course, this all comes at a price. Travel restrictions mean that about 100,000 seasonal workers, for example, could not travel to Germany, helping with the harvest. And retailers already warned of food shortages because of that. And of course, the economic impacts. As of the 1st of April, nearly 500,000 companies in Germany alone applied for the state-funded reduced hours employment compensation. So the future challenges regarding this lockdown and the continued lockdown, as it looks as of now, will be with us with quite some time. So thank you very much.
Well, good afternoon, everybody. My name is Benoit Blangy. I'm Associate Director, Technical Services covering Benelux. So in the next 4 slides, I will underline the different phases we have observed within the retail sector during this ongoing crisis. Not mentioning what happened before governments decide to go for a full lockdown situation, we can summarize in 3 phases the evolution of the crisis, mainly driven by consumers' behaviors on one side and internal external supply chain constraints on the other sides. So in phase 1, let's say the first 2 weeks after the full lockdown measures, panic was on board. So this panic situation led to a rush in the shops to secure some family strategic inventories like food and non-food. The supply chain was not under pressure, since most items were covered by enough inventories, which was we call the safety stock at warehouses, supermarkets, or even at food manufacturer sites. The pressure was put, on the other hand, on the shop floor in order to help the labor to fill the shelves at higher rate than usual, and forcing retailers to reallocate some laborers in specific strategic services. We have seen a huge drop in complaint system collection from the shops, meaning that the employees were not available anymore to collect the complaints, leading to a strong decrease in complaint number at some retailer sites. On the other side, we also have seen an increase of online sales activity, driving, and so on. So labor were reallocated to prepare the sales order in order to face this booming e-commerce activity. So in phase 2, let's say from week 2, 3, after the panic started, we reach a kind of new normal situation with stabilized sales volume at higher rates than usual. We usually say that higher sales is going to 20, 25, 30% than usual. And this percentage is what the consumer do not consume anymore going out for dinner. We also think some initiatives from retailers like Tesco or retailers in France are trying to organize home delivery and partnering with Uber Eats in order to help their consumers or their clients to get their food at home. But those kind of initiatives has been difficult to implement and seems to have stopped for the moment. In phase 2, the supply chain at food manufacturing sites start to face an increased pressure to keep delivery the warehouse and the shops at higher rates than usual. And the combination of increased productivity on one side, lack of labor or skilled people in the factories due to sick people or social distanciation measures imposed, the lack of raw material for imported products and leads to a slight price increase of some product categories. In phase 3, this is typically what we have seen in some countries like Belgium, unions start to mobilize and to offer or negotiate compensation for their workers in the sector because they are working under growing pressure, labor shortage, and so on and so on. And they try to get compensation in order to not go or decide to go on economical leave, which might be interesting for them compared to other sectors. This is typically the case for Belgium, for example. Moreover, what we have seen is rising consumer concerns regarding potential cross-contamination from surfaces or food to human, even if not proved yet. There is a lot of articles coming out and studies mentioning this potential contamination, or at least that the virus stays on surface and food for 2 hours, 4 hours. We are not speaking about 9 days on surfaces. And this indirectly, of course, leads to a question mark from consumers saying that, yeah, maybe better to buy local products where origin and traceability looks safer than buying other items. But at the end, the lessons learned during this crisis will probably accelerate some ongoing trends in the retail sector. So not new trends, but ongoing trends. Retailers will need to reevaluate their risk exposure, not only on the product specification side, looking at origins of ingredient and so on, in case cross-contamination happens to be at the end an issue for this crisis, but also in terms of labor protection in the shops and the type of online tools used to manage booming and increasing e-commerce activity. So retailers, after having done this analysis, will try to go to a smarter supply chain management. Smarter means not better, but smarter means more flexible. Today, retailers are sitting on a pile of information regarding their product specification stored in tools such as TraceOne. It's a huge amount of information that is not evaluated at the right way today. So the system will probably need to move to a smarter way of management with a dynamic management of all those data to mitigate and to analyze any potential risk for future crises. I will take here the example of the Belgian mask stories. You probably have heard that. We had a strategic stock of 3 million masks that has been destroyed 2 years ago because of overdue shelf life, and this was not replaced for cost reason. So better supply chain management means more of the time cost optimization of the supply chain. But what we see now is that the safety stock of the strategic safety stock will have to be revised in order to cover and anticipate such kind of crisis in the future, which will lead, of course, to some cash constraints, mobilization, and so on. The most important, and this is probably new, is that retailers might ask their supplier to demonstrate virus-free supply chain integrity. Demonstrate means proving that their supply chain is virus-free. We all have in mind this this norovirus outbreak in Scandinavian countries every 2 years happening from frozen fruits, for example. But we think that the suppliers able to demonstrate that they have a correct thermic treatments above 60 degrees for a few minutes, that and then followed by 100% automatization and no people handling the foods afterwards and so on, might be able to prove that they are kind of virus-free companies. And demonstrate also means that this should probably go to kind of visual logos or claims saying that this specific product is virus-free compared to other products. There is, according to this risk analysis, also a trend that might happen is in case some suppliers cannot prove that they have virus-free environments because of lack of assets or because just the process doesn't allow this, retailers might move to reinforce the portfolio mix of local products. So the old motto supply chain, buy global, sell local, might move to a buy local, sell local. It's a smaller supply chain blocks, but this is also a way to mitigate risk in case cross-contamination is allowed from surface foods to human, of course. And the rest, you will probably have trends in the retail sector, which is already existing, but will be reinforced by working with simpler products, local products, banning some origins, but this is just ongoing trends that might be reinforced in the future. Thank you.
Hello, thank you, Benoit. My name is Jackie Healing. I lead the consulting and technical services for NSF in the UK, and I'm going to share with you some of the insights we have gained and some of the ideas for the future around food manufacturing. So the main issue that we're all facing with our food manufacturing sector in terms of the quality management of that sector is the traditional tried and tested methods, which involved a lot of site visiting and auditing and inspection and presence of first productions and that type of thing are no longer available to us. So at a time when the manufacturing sector is under greatest pressure for increased volumes, as Benoit has discussed, and potential labour shortages and other impacts, the risks are even more increased than usual. It's arguable that the methodologies and techniques we have to help mitigate that risks are no longer available to us, and we've got to find some other ways of ensuring our supply chain is integral. So just delving into that in a little bit more detail, not dissimilar to what's being seen in supermarkets, the operational challenges that are being seen in factories, an increase in the requirement of volume to be produced, as Benoit mentioned, something like 20% uptake in sales for most supermarkets. Trying to handle that when you've got to socially distance your personnel and manage shift changeovers, particularly if you need to have a very intensive hand wash regime in place. We're seeing staff absenteeism due to sickness or people caring for sick or isolated individuals, and that's leading some factories to need to recruit high levels of untrained workers. And while some factories are seeing massive uplift in sales, others, because of changes in eating habits, particularly around the convenience and snacking lunch type of offer, we're seeing factories close. On the supply chain side, we've got ingredient shortages due to border movement restrictions, shortage of drivers, changes in backhauling patterns, and some countries, as Benoit mentioned earlier, and Meike mentioned earlier, struggling to get the labour they need to do some of the harvesting. The fact that we're seeing countries like India now go into full lockdown has to raise the risk that some food fraud challenges will come to the fore. Spices, herbs and spices have frequently been an area of concern in that regard, and that can only be heightened under the current circumstances. And finally, on the hygiene and pest control side of things, what we're seeing is that these factories who are under pressure to produce even more in shorter periods of time with less skilled workforces are finding their routine hygiene and maintenance windows in the factory becoming compromised. And those who are having to close down have got to make sure that they've taken all the necessary steps to ensure their factory is effectively proofed and storage of raw materials is properly catered for, particularly in the Northern Hemisphere where we're coming into the summer and the increased risk of stored product insect. So there's all sorts of things that people are doing to help mitigate and manage these challenges. And one of them is to think about the approach they've normally used to approve and manage their factory quality programs and overlay the COVID-specific risks that we've just talked about. Using more listening, questioning and root cause analysis techniques to try to get to the bottom of what really is the causative factor is really important, as opposed to a traditional, arguably tick box style of approach of visit. Taking advantage of any remote operational activities that you can use to assess a factory's performance from afar. Using other tools that may already be available, such as databases of approved factories and certified factories to look at alternate raw material sources. Definitely revisiting the food fraud risk assessments and overlaying these new risks. Thinking about the temporary labour, making sure that it's being recruited responsibly, particularly if you're having to use agencies to help provide that labour. And of course, while it's very easy to get buried in the real day-to-day of this, you've got to start to plan a little bit for the future. Just touching a little bit more on that supply chain alternate sources, ourselves at NSF plus many other organisations hold very large databases of ingredient sources and manufacturing site details around the world. We're able to, in the event of a supply chain disruption, galvanise our resources to mine that data and provide companies with lists of alternate supply sources that we know to be certified and approved. It's a program that has real relevance at the moment, but also very relevant in times of other supply chain disruptions through weather events or social unrest that we've seen in the past. So what is the next things we need to think about doing? Well, one thing's for sure, we're not going to come out of this overnight and go back to normal. Many of the practices that we've talked about and we're seeing implemented are going to need to carry on for some considerable time into the future. You'll need to keep factories socially distanced until we have effective testing regimes and vaccination protocols available to us. You may find labour availability in the longer term more difficult. Some people may not want to or indeed be able to travel. There may be restrictions still for some time to come. And people will certainly potentially be more nervous about travelling internationally. Some eating patterns may well change. We're seeing a lot more home cooking and that might become the new norm. We may see a shift in the type of food production that your factories are being asked to produce. Clearly, raw material supply is going to be absolutely critical and we'll need to overlay new thinking around those supply chains to ensure they're resilient. Once people can go back out and visit their suppliers, you can expect a massive onslaught of customer audits and visits. You might need to prioritise those. Some of that thinking needs to start, I would suggest, as soon as possible. Christmas is coming. There'll be some huge production priorities that need to be accommodated in light, irrespective of all those challenges. And I think this is an opportunity to get on the front foot now, be a manufacturing site of choice, not only for your employees and workers, but also for your customers. Thank you.
Good afternoon, everyone. My name's Craig. I'm based here in the UK, and I'm going to talk to you in brief this afternoon around COVID-19 and the food takeaway and delivery sector. So what we seen across Europe in the last month? It's been a very interesting time, to say the least. Most governments have taken the view to lock down businesses out there that encourage social interaction, namely restaurants, cafes, bars, and other establishments where people congregate in an attempt to minimize the spread of COVID-19. And I'm sure many of you out there today have been affected in some way. We've also seen that takeaways have been, certainly in the UK, identified as an essential food business and continue to trade in most cases. There have been some reports across Europe that initially, in mid-March, there was a significant decline in consumers ordering takeaways, but that rebalanced itself by the end of the month. So, as I'm sure you've again all seen, panic buying initially because of the uncertainty. There was some confidence restored 2 weeks later, and businesses, particularly the takeaway businesses, returned to normal. And the trade that was seen coming through online food platforms restored itself. In many cases, online platforms have reported a restoration in share prices, which is, I guess, encouraging for many other businesses out there that are currently closed. What we have seen is a lot of businesses that perhaps historically have never offered takeaway or delivery services attempting to diversify in order to maintain an income. And those new processes associated with serving and preparing food in that way brings with it some new processes and consequently some new risks and new challenges. We've also seen a rise in the number of community groups that are wanting to do their bit and support those key workers in producing foods either for donation or for delivery. But again, that brings with it some key risks and concerns that certainly we have around maintenance of the temperature control chain throughout the process, both in terms of production of food within possibly a temporary kitchen, all the way through to delivery of that food en masse to whoever the recipient may be. Coupled with the temperature controls, we've also got some concerns around allergens and how well those allergens are being signposted to potential recipients. Again, these community groups are very noble in their gestures and want to help and contribute, but equally there needs to be some consideration around key food safety risks that could potentially have some fairly unintended but catastrophic consequences. Therefore, planning is paramount. So what are we doing here at NSF? Well, as my colleagues have already touched upon, we are here, we are helping, and we are trying to innovate at this time in order to provide some expertise, awareness and knowledge around some of these critical food safety and health and safety risks within the business. So we've developed a range of materials that can support businesses and also the provision of a free helpline to answer any questions that businesses may have, either those that have been moving to a new style of offer, takeaway and delivery, or those that have decided to cater for those groups that we've spoken about already. Equally, for those that are catering for vulnerable groups, those that are immunocompromised in some way, perhaps more susceptible to illness or infection at this time, just being considerate of their needs as well when producing food. We've also hosted a number of advisory calls within the UK for our customers and associated colleagues in the market, and those have proved to be very useful, not only as a way of sharing information, but also facilitating that discussion amongst peer groups in terms of what happens next. We've also been engaging with trade associations and consumer groups, trying to get this information out there as much as possible, using social media to track businesses and community groups that are providing for these groups of people that we've spoken about already. And finally, and perhaps optimistically, we will return to business at some point in time, hopefully as soon as possible, but also as safely as possible. And our next sort of primary focus is looking at how to do that in a controlled way that enables consumer confidence and ultimately protects the brand reputation of businesses that we are working with in this particular sector. So more on this to come, but yes, that's our primary focus for going forwards. Thank you very much.
Hello, everyone. My name is Shan. I'm Managing Director from China team, and that's the China team. It's really my pleasure to share some information and experience from China. So in China, currently we have an existing infection case reduced down to around 2,000 people in total China, and a travel restriction has been lifted for every city. That means people can go anywhere. It's pretty safe. However, people still need to wear a mask and keep a social distance. And most of the store and restaurant is reopening now. So I'm going to talk about some practice in China for reopening. So I think before you just prepare for some operation management before you return to the work. The first I think is you should set up the management team to deal with COVID-19, and also you should establish the quarantine system. In China, the government have established the quarantine system. And also, you know, in each store you have to check the body temperature, and also you have to prepare the disinfection process in place, and also you have to register how you healthy for the in China the government established system that every people need to register in this system. Then this government have a database to track back, for last few weeks where you have been, and also if some place you have been was defined as a high risk place, then as a result, they will show you some barcode in your mobile, which is in 3 different colors. The green colors means you can go anywhere. The yellow color means you some restriction to some place. And if you got the red color, that means you have been you have to be in quarantine in your home for 14 days. So and also for some store and the restaurant, they encourage the customer to using the online booking system. That means using the store and the restaurant, they're using the booking system to control the number of people and also control the density in the place. And when you start to open your store and the restaurant, normally in the first few weeks, you just want to reduce the open hours to reduce the risk. Some restaurant or some of the store, they only open half days. So after a few weeks, your restaurant and your system getting used to the new policy, then you can extend more hours. And also you have to increase the indoor air exchange rate to keep the sufficient ventilation in your place. And in China, before you reopening, you have to comply with local government new policy. You have to apply for this reopening, just like you have to apply, provide some documentations, and also the government will offer some audit to your store before you're reopening. If you fail, you have to improve. Otherwise, if you pass, then you can reopen. And also you have to prepare some mask, some thermometers, gloves, alcohol-based sanitizer, etc. For customer services, as I talked before, you have to using the online booking system, and also you have to you'll have at least one staff to stand outside in front of the main entrance. This staff to check the registration card to see if the green, yellow, or red. Then the staff have to check the body temperature of the customer, and also the staff need to just show the customer the guidance how to go into the store, and by using some posters, by using some brochures, and also some restaurant or store, they prepare some video just show the customer how to deal with that. And also each customer, they have to check the body temperature, and also every customer, they need to wear a mask, they need to washing hand before they enter into the restaurant and the store. Also, this is this kind of information you need to be tell the customer, then just try to avoid the customer concerns. And also, most of the store, they're using the apps order, or they're using the iPad order system, because they try to avoid the people contact. Some of the store, they're using touch screen to play the order. For staff training and also the management. So before you open the store, you have to train your staff to understand what's the COVID-19, what's the virus, and also you just ensure that the staff will follow up the new policy. And also, of course, the internal staff make sure they're washing hands, wear a mask, and also the staff meal will keep the staff meal safe. And in addition to that, you have to control the environment. So maintain the air circulation. You just clean all the surfaces, including some high risk area, like a elevator, like some toilet, and also including every services, including front desk, the sofa, doors, windows, very frequently. And also you have to, for the food preparation area and the kitchen, you have to keep it clean, and also the sufficient disinfection. For food safety, I think it's just compared to your maintain your food safety, you have to increase the frequency to keep it clean. The main point is like purchase, storage, food preparation area, and also you have to sampling before servicing. And the last part, I think, is when you've done this part, you have to tell the customer you have done that part, and also you need to make sure everything you have to transparency to your customer, and just using every channel like media channel to just try to build the customer confidence before they go into their store. So this is I think this is a really difficult part, but I think before you have sufficient preparation, I think you can get it done. Thank you.
Thank you, YuLong, John, and to all our presenters. Now we're starting the Q&A session. I already see some questions in the chat box, and we have received some questions via email beforehand as well. James Howard is asking if you're sharing the deck after the presentation. Yes, we will be sharing also the recording. Good afternoon, Jan Drokmans. How can virus-free product or supply chain be validated by food business operators who purchase raw material from those supply chain? Who would like to answer, Jackie?
Sorry, I didn't quite catch the question. Could you just say it again?
How can virus-free product or supply chain be validated by food business operators who purchase raw material from those supply chain? Maybe Benoit or Jackie, who would like to answer it.
So virus-free supply chains. Well, this was an observation that Benoit made, that it might be something that is a trend of the future. You know, we know that the virus doesn't survive routine food safety processes such as cooking or drying, and we also know that it finds it quite difficult to be transmitted through packaging. So I don't think you'll need to do any more specific validation of your supply chain than you would normally to approve a raw material source. I mean, this is all emerging science now, so Meike might have some other thoughts on this, but I would say that your normal, if you have a robust raw material supply chain approval system today, which is a combination of site approvals, recognised certification, routine testing, ongoing surveillance and monitoring, then I think as long as those disciplines are, those good food hygiene disciplines are in place in that supply chain, then I wouldn't anticipate you need to do anything more to secure the source of supply from a food safety point of view and a virus safety point of view into the future. I think the thing that does change is that, you know, we've now had a global pandemic that's disrupted global supply chains in a way that we've never seen before. And that's going to change how we need to think about risk assessments for sustainable supply of ingredients into the future. It's early stages of the thinking, but, you know, I think in the past we've always assumed that if you lost your supply of beef from Argentina, as an example, you could have gone to Uruguay, you could have gone to Australia. That is something that just doesn't exist now. And so the age-old methods of maybe single sourcing, single country approval, single site approval of the raw material from a contingency point of view into the future may not be the way to go.
Thank you. I'm reading a question. The next one, I would like to ask, would it not be something to look at for the future to gather all the results in one sort of standard, so no longer different ways of understanding and misunderstanding, one standard? This will then allow to put the information on an online platform. What are your thoughts on that?
Well, I think the GFSI, I mean, asking to come in on here from the food manufacturing point of view, that was the intention of the GFSI standards being developed, which that they were mutually recognisable and they were consistent. We all know that that hasn't quite worked out as planned for all sorts of reasons, not least individual brands wanting their own individual protocols and protections and standards to be assessed. I do think the need to share this data more widely is a really valid one. I mean, we've had encouragement from both the European Food Standards Agency and the Food Standards Agency in the UK to try to get greater transparency of this data. And I do think that that's something that we need to think about for the future. But to come about, I think it would probably have to be led by the regulators, by the governments.
Mm-hmm. Thank you, Jackie. And the next one is for John. In China, is 2 meter social distancing a requirement? If so, how is it achieved in the restaurants and kitchens?
Restaurant.
Okay, we start hearing. Okay.
Sorry. So in the restaurant, I think the first they just control the numbers of customer. They control the people density. Then the people going into the restaurant, they have to leave the next table empty. Just sit. Keep the distance at least 2 meters between each tables. This is the method they're doing now.
Okay, thank you. The next one is for Meike. Meike, can you clarify this statement? Currently, no transmission is known provided food hygiene is observed, but if it isn't observed, could food be a vector? Sorry, my screen moved. We have been told the virus is respiratory, not gastric. This is the question.
Yes,
Meike,
the virus itself is respiratory, so the main infection route is via coughs and droplets. So of course, close contact with persons who sneeze into their hands, these droplets they transfer to the hands, and of course the close contact like touching is possible. So there's no current case, I think, where there's a direct foodborne transmission. as long as proper hygiene is observed. Of course, if you have a worker that's sneezed into his hand or her hand and touched the food in question, there's always the possibility for a contamination, but it's not the main pathway at the moment. So if the food hygiene is observed as it should be usually in production facilities, then it's not the main transmission route.
Mm-hmm. So do you still suggest washing the fresh fruits and vegetables while at home?
Of course, you always should. We have other zoonotic diseases. We talked about norovirus. The norovirus is very stable. Its tenacity, it's up to 3 weeks, I think, on if everything's correct for it. So washing food itself is always the way to go, or cooking food that needs to be cooked, of course.
Mm-hmm. Another question for you. You say so, Meike, you say soap kills them, and it means people with high level of contamination are not following recommendations. It's a question mark. And does it also mean a soap-based vaccine could help? You're asking you about the vaccine idea. Yeah.
Well, the vaccine's quite a bit off, to be honest, I think. So the physical distancing is the way to go at the moment. So we can't wait for the vaccine, if that's the question.
This question is, I think, to Benoit, so that clients can log on to that platform to view the latest results of a production company. This will then allow less controls and give the quality team more time to implement and follow up on the needed rules and updates since COVID.
I'm not sure about this online platform you mentioned. I think they're putting information on an online platform, globally speaking, doesn't mean that you need to stop every controls on the factory, of course. It gives, like, project specification management, it gives you a feeling of having all information in hand to take the right decisions to some extent. But the question is, do you use this information? Everybody, I think that the people delivering in the retail used to use TraceOne, such kind of tool to put informations. It's complex. It requires a lot of time from quality people in factories and so on. Does it mean that this information is controlled at the end and is used to mitigate risk? That I'm not sure. So quality control and safety controls have to stay at factory sites. And maybe this question is related to the first one. I would say that I will take an example. In the frozen industry, you have on one side vegetables, and on the other side you have fruits, frozen fruits. Vegetables are normally blanched. So normally when you blanch vegetables, you avoid or you decrease by far the risk of virus contamination. Frozen fruits is another business in the same industry. Frozen fruits in bags are used to make smoothies most of the time, even if it's claimed on the packaging, please cook before eating. But who is doing that? Nobody. So the question of risk mitigation about virus-free supply chain integrity, to come back on the first one, is will be easy for some industry players like biscuits or rice cakes. The rice cakes are cooked at 300 degrees. So, and afterward there is 100% automatization of the process. So there is even if contamination from the raw material of contamination from people, it cannot happen in the factory. For other business, it might be more complex to demonstrate this kind of integrity. And this is also why we think that local products will be increasing in the coming years, because this is a way to split the supply chain in small blocks in order to mitigate the risk of being delivered by a big player in an industry.
Okay, thank you. Do you have a guideline for takeaway businesses or restaurants who recently switched to a takeaway business model? Craig, I think it's, yeah.
Absolutely, we do, yeah. I mean, there's been some widely published guidelines from trade organisations and professional bodies here in the UK, namely the Food Standards Agency and the Chartered Institute of Environmental Health. We have consolidated that into an information sheet for those businesses that are an existing food business, but just wish to pivot or transition to a takeaway and delivery option. So whoever's asked that question, again, we'll share it with the attendants here today. We'll share that info sheet so that you all have it and can refer to it should you wish.
Thank you. What are the areas food auditors to look for in the next 1 to 2 years for a better manufacturing and services? Is the question clear? No.
You want me to take that one? So what was the question? So what are the areas to look for in the future?
For auditors, food auditors, to look for in the next 1 to 2 years. I don't know what exactly the question means.
In terms of the change. So I think we're not going to change what we've historically looked at, but I think when we come out the other side of this, we will probably be wise to take some time to think about what have we learnt from this experience. Let's assume that we would have another one in our lifetime, and therefore what would we do differently in terms of our preparedness and readiness to tackle it should it come again. It's interesting because it's a dilemma. It's a dilemma around, you know, the need for fast, efficient food produced in very intensive environments, and then you get something like this where that intense production environment is no longer possible. I think businesses, whether they do it through the traditional technical audit or whether they do it through part of their business continuity channels, will want to add to that assessment companies' ability to flex in the event of another pandemic. Because the pandemic we're in was predicted by many, and I think it would be wise, having lived through one, to assume that this isn't the last one. And so what do you need to do differently now with your supply chains and your operations to be more prepared for the next one than you maybe were for this one? But I'm not sure it fundamentally usually falls to the technical people to do that type of thing, I know, in businesses, but it's more, to me, a business continuity challenge.
Okay, thank you. There is a question about NSF COVID-19 Rapid Response Team contact details. Philip Quinn has asked, and we'll be reaching out to you afterwards with the contact details. And for YuLong, how long will the post-lockdown hygiene requirements for masks, online bookings, controls to enter stores, temperature checks, etc. apply in China? How long these measures will?
I'm not sure if John's still there.
John, are you still here? He must have, yeah. He's here.
He's there.
Hi, John. Do you want me to repeat the question? There's a connection issue, I think. Okay. Okay, we're not hearing you, John, and we're going to also reach out to you, Debbie Brandt, with the answer. And there is one question. I said, what are the new regulations for restaurants, production and delivery during and after this pandemic? If there's any regulations, are they going to be the same for each country inside the EU? Is there any information on that, Craig?
Well, we haven't seen anything, certainly not emanating from the UK, around additional controls that will be required. I think obviously a lot of governments within Europe are looking to China and the response that they've produced following the pandemic there and returning to business. So there is a possibility that some of the control measures that have been exercised in that market may well feature in a return to business in the UK and across Europe. But to this point, we're not aware of any specific regulations concerning COVID that will come out and affect restaurants when they become reopening. But I think just to touch on and reinforce a point that John made, it's about giving that consumer confidence that for any restaurant operators that are out there on the call today, that your practices, procedures, and behaviours, I think, of your teams within those restaurants are there to give confidence to customers when they return back into the businesses. Who knows what that will look like? I think that there will be a potential slow burn as we reintroduce ourselves to one another socially. So yes, we'll see how that manifests itself.
Okay, thank you. And there is one last question for Jackie. Actually, you kind of answered these, Jackie, but do you have any guidance as to how to best maintain quality and safety of ingredients or products without the traditional audits and inspections? And the other one is like, is there going to be a change in how we manage food safety and quality ongoing? Which you partly answered, yeah.
3 minutes to answer that. So yes, there's obviously other tools. I mean, most people would use some sort of pre-assessment questionnaire anyway, so I think you would use that. There are remote audit programs that have been established, some quite successful ones, which are asking, running through a sort of inquisitive questionnaire and doing some root cause analysis and giving a manufacturing premises 4 hours to complete a full traceability and submit that information online or through a portal. There's also the use of cameras and remote monitoring. And then there's obviously, you can do some enhanced product testing as an example, which you would normally only do to validate your upstream controls. You can put a much harder, much more rigorous and intensive testing program in place just to increase the chances of finding anything that was out of specification. And in terms of, what was the second part of the question, sorry?
Is there going to be a change in how we manage food safety and quality? Sorry.
Look, I think the other side of this, we'll be able to evaluate whether the fact that we were not able to travel, you know, that traditional method, maybe I'm thinking of teams I manage where, you know, they spend 3 days a week in premises to manage the quality and safety of that product. They're probably going to go 3 months without ever visiting the premise. What change in safety and quality occurs as a consequence? And then I think you've got to ask yourself, you know, what's the correlation between the amount of time you spend traveling and visiting and its real impact in driving product quality, and question whether there might be a different balance to be struck. I'm not sure we will go back to the way we were doing it before. I think it would be appropriate to question whether that is the only tool that we can use, and also whether it's right to, you know, to do all that traveling again, whether you'll even be able to be honest. You know, we won't have the flights, I'm quite sure, coming back in the way that they were. Maybe the hotels won't be open. You won't be able to switch it back on straight away anyway. So I think, you know, if you're currently not visiting manufacturing sites and you're thinking in 2 months' time you'll be able to do it again, I would think again. I don't think that opportunity is going to come back in the way that it was much before the end of the year, simply because the businesses probably won't be up and running in the way that they were. So we need to find other ways of doing it, for sure.
Thank you. We're ending the session now. It's been 1 hour already. Thanks for joining us today and contributing to the discussion with your valuable questions. We will be sending you a very short follow-up questionnaire right after the webinar. Please fill this out so that we can plan our next webinar accordingly. Have a good day and stay safe, everyone. Bye.
Bye-bye.